Hello, my name is Deanna Hefner, and today's presentation will go through my program design, and it was titled At-Home Caregiver's Guide to Stroke. Today's topic of discussion will include the introduction, the overview of the program, Stage 3.1, the lesson plans that were developed, Stage 3.2, the supporting materials for my Stage 3.2, and the references. Stroke recovery can be difficult for not only the stroke survivor, but for the family and at-home caregivers as well. The recovery process can be mentally, emotionally, physically, and financially challenging. Stroke survivors and their families often leave the hospital with little to no education and lack the full extent of their caregiving responsibilities. I decided to design this program and the lesson plans due to my personal connection. Both my father, about 2.5 years ago, and my grandmother this past August both suffered a stroke. Luckily, they were minor, but there were some difficulties when they were discharged from the hospital. My brother, my wife, and I were all the caregivers for my father. My mother is currently the caretaker of my grandmother, who is 92 years old. She has been living with my grandmother for, I think, over 5 years now. But we have noticed a significant downfall since her stroke, and it was brought to my attention by my mother the lack of education that she was provided after the discharge from the healthcare providers, which kind of helped me develop my lesson plans. She made mention that she was unsure as to what diet she should follow, the benefits of the diet, how to manage the diet for my grandmother, because she currently kind of eats like a child, unfortunately. So it has been difficult for her to find foods that my grandmother will eat. She was also unsure as to what she should do, like rehabilitation-wise, and the things that she should be doing for her there, as well as many other things. For the overview of the program, there has been an increased need for educational programs that include post-stroke management. Post-stroke management topics can include management of stroke risk factors, the increased need for stroke signs and symptoms knowledge, nutrition education, and their relationship to food and health, as well as diet and diet management. Post-stroke support, including that of healthcare providers, is very highly important for the recovery process for not only the stroke survivors, but the family members and the at-home caregivers as well. There is an emotional self-management support that is needed, but this post-stroke support can also consist of providing patient and caregivers the education about health, disease, patient prognosis, therapies, when to call 911 if another stroke were to occur, as well as develop skills in the monitoring, problem solving, and decision making. And there has been a big push for post-stroke recovery and the collaboration with stroke survivor families and caregivers with patient-centered care. Research has shown that there is an improvement to the risk factor management and post-stroke outcomes. And taking these steps to provide this education can assist with the prevention of a recurrent stroke, as well as maximize patient function to regain their independence throughout their recovery process. Stage 3.1 provides a breakdown of the 4 lesson plans developed for this program design. On this slide, this table here represents just 2 of the 4 lesson plans that I was able to design for this program, as well as the title and the goal. Each lesson plan provides a breakdown of the associated goals participants are to achieve. These goals are then supported by the understandings and the knowledge, and they represent what the participants will understand and know at the end of each lesson. The essential questions are developed during this stage to answer relatable questions to pull the lesson all together. Throughout the lesson plans, participants will gain valuable skills that they will be able to implement into their daily lives. Formative and summative assessments are used to clearly identify what the participants will do, such as complete quizzes, participate in scenarios, or complete food logs, for example. Remediations are completed at the end for the instructor to review the provided material and be sure the participants have reached their goals, understanding, knowledge, and developed skills. For my program design, I was able to develop 4 lesson plans. Lesson Plan 1 is titled At-Home Care for Stroke Survivors. With this lesson plan, the goal is for participants that they will have an increased confidence in education to improve their ability to provide at-home care for stroke survivors, as well as know who and how to collaborate with healthcare providers. Lesson Plan 2 is titled Signs and Symptoms of Stroke and What to Do if Another Occurs. The goal of this lesson plan is that at-home caregivers will have an increased confidence in their ability to recognize the signs and symptoms of a stroke and what to do if another were to occur under their care. With this lesson, there is a focus on the FAST acronym, as well as mock scenarios of what the caregiver should do if another stroke were to occur, such as call 911 and provide adequate care until EMS arrives. Lesson Plan 3 is titled Nutrition Education and Diet Management. This lesson plan will be broken down in the next slide. The overall goal of this lesson plan is that at-home caregivers will have increased confidence in stroke diet and diet management. And for my final lesson, Lesson Plan 4, it's titled Food Labels. With this lesson, at-home caregivers will have increased confidence with food labels, and they will be able to identify key macronutrients, as well as understand the benefits of the food label itself. Stage 3.2 is the outline for Lesson Plan 3. This is a small table representing just the beginning portion of the lesson plan outline itself. The third lesson plan was developed to introduce participants to the Mediterranean diet, the food impact on health, and diet management and food logs. This lesson plan is geared toward increasing at-home caregivers' confidence in stroke diet and management. This goal can be achieved through the understanding of the Mediterranean diet and its importance with stroke, as well as gathering an understanding of how to manage a diet. The introductory question and prompt will be able to hook the audience and grab their attention. The beginning of this PowerPoint lesson, which the supplemental material is on the next slide as well, it will introduce participants to the main learning points, which include food's impact on health, the Mediterranean diet, and diet management and food logs. These topics will be able to address the essential questions of how does the food we eat have an impact on our health, and why is the Mediterranean diet beneficial for stroke patients. These essential questions will be able to help the audience know where the lesson is going and what is expected of them. The first topic of discussion explores the aspects of food and nutrition and how it impacts one's health. The dietary choices we make influence disease risk. Food can provide medicinal benefits, although it is not a substitute for conventional medicine. Dietary habits have been supported by research that shows an influence risk of certain diseases, and certain foods can lead to chronic health conditions, while others offer therapeutic and protective qualities. These key ideas will equip the participants and help them experience and explore the issues. Before participants are introduced to the next topic of discussion, they are prompted to share some of their dietary food choices they currently make at home and if they actively follow a diet. This is to assist with showing where the lesson is going to go. This section of the lesson will help participants gain an understanding and knowledge of the Mediterranean diet and its importance with stroke. The Mediterranean diet is traditional eating habits developed in the countries bordering the Mediterranean Sea. This diet has a focus on plant-based foods, lean proteins, fish and seafood, whole grains, fruits and vegetables in a variety of colors, healthy fats, and adequate portion size. Participants are then asked to quickly share what food choices they make that are appropriate and inappropriate to the Mediterranean diet. The next topic of discussion is a focus on the Mediterranean diet and its benefits for stroke patients. This will equip the participants and help them experience the key ideas and will assist with their understanding and gain of knowledge. The Mediterranean diet can assist with lowering blood pressure, lowering cholesterol, lowering BMI, and assist with weight loss, and it can reduce the risk of a recurring stroke. A brief discussion will follow this lesson to provide an opportunity to rethink and revise understanding and to assist with skill building where participants will be asked to provide a brief explanation of the Mediterranean diet and its focus foods. Participants will have the knowledge to provide accurate answers. For the instructor to assist the participants and provide additional opportunity to rethink and revise understandings, they will be provided with a 24-hour food log menu consisting of 3 meals. Each meal will contain 2 items that are compliant with the Mediterranean diet and 2 that are not. The participants will be asked to make appropriate substitutions for the non-compliant foods. The summative assessment will allow the instructor to tailor the lesson to the different needs and interests and abilities of learning, and remediations will be provided. For the remediation, at-home caregivers will be provided with a second 24-hour food-long menu consisting of 3 different meals. The participants will again need to identify 2 compliant items and make substitutions for the 2 non-compliant items. For formative assessments, the instructor will prompt the participants to provide a brief explanation of the Mediterranean diet, where they will correctly explain that it focuses on plant-based foods, lean proteins, fish and seafood, whole grains, fruits and vegetables in a variety of colors, and health fats. This will provide participants with opportunities to rethink and revise their understandings by allowing participants to evaluate their work. The instructor will then be able to tailor the end of the lesson and remediation to review the Mediterranean diet in the focus groups. The initial question will be rephrased and asked again. The participants will also be prompted to explain the Mediterranean diet benefits to stroke patients, where they will answer that it can help lower blood pressure, help lower cholesterol, help lower BMI and assist with weight loss, and can reduce the risk of a recurring stroke. The remediation provided by the instructor will rephrase the initial question and ask again. For the final lesson, the instructor will prompt the participants by asking if they ever recorded or kept a food log and if they understand the importance of diet management. By asking this, it will hook the participants' attention back into the lesson and will assist with knowing where the lesson is headed. Participants will be introduced to the importance of diet management and food logs journals, where they will gather an understanding of how to manage their diet at home. A food log journal is a living document used to keep track of what you eat and drink throughout the day. A food log journal is beneficial as you manage your weight, identify trigger foods, recognize habits, and eat more mindfully. The instructor will then expand the participants' knowledge by providing steps on how to keep a daily food log journal. 1. Start slowly by recording what you eat, 1 meal at a time. 2. Record after eating, that way you can keep track of your food without forgetting it. 3. Try different tactics by using different approaches such as counting calories and listing foods and drinks. The last step, step 4, is to choose your platform by using pen and paper, applications on your smartphone or smartwatch, or with the use of fitness trackers. The instructor will assess the participants through summative assessments, which provide an opportunity to rethink and revise participant understanding. The participants will be provided with a 24-hour food log where they will be asked by the instructor to record their family members' meals for the last 24 hours along with portions. After a discussion, once the food log is complete, they will be discussed. The instructor will be able to tailor the final part of the lesson by providing a new 24-hour food log for participants to complete. At the end of the lesson, the instructor will provide the participants with a Kahoot quiz to assess if they have reached their desired goal, understanding, knowledge, and skills. Participants will need to correctly answer 3 out of 5. After each question is answered, the instructor will provide a brief explanation as to why the answer is correct or incorrect. As a remediation, the instructor will rephrase each question and ask the participants to answer again. The instructor will wrap up the lesson by asking if the participants have a change in confidence in implementing the Mediterranean diet into their lives, how they incorporated what they have learned into their own home, if their confidence has changed in the understanding of the benefits of food to health and stroke recovery. They will also be asked if their confidence has changed with daily food log journal record keeping, and how they intend to move forward with supporting their family members' needs during the stroke recovery, and what aspect of the program helped them the most. This slide has little snippets of the PowerPoint that I made for my Lesson 3 design, and it was on the nutrition, education, and diet management. I've also attached the 24-hour food log of the menus with the compliant and non-compliant foods, and the participants are to pick out the non-compliant foods and make the substitutions. This slide is a continuation of the supporting materials for my Lesson Plan 3. On this slide, it provides the blank food log for the participants to record the 24-hour food log of their family member. And it also has a little bit of the Kahoot quiz that I designed with 2 of the 5 questions that were asked. And here are a few of the references that I used throughout my presentation. Thank you very much for watching.